again, it's Nas, an advocate for drug misuse in Uganda. We are back again. We are still giving you guidelines and a lecture about drugs. And today I want to talk about rights of drug administration. Now, drugs have rules that govern them. It's not just like food that every time I'm going to feel I'm hungry, I'm going to get food. It's not that it's a drink that every time I feel thirsty, I'm going to take a soda or water. You have to follow. There are some things you have to pay attention to when you're dealing with drugs. That's why people go for trainings for 3-4 years. They are training on how to treat someone. Now, for you, when you want to do self-medication on yourself, you also need to bear in your mind that there are things that you need to follow when it comes to taking drugs. And these rights include the right drug, the right route, the right patient, the right disease, the right dosage, the right site. Now, when we talk about the right drug, are you sure that that drug you're taking at this moment, the right drug you're supposed to take for that you're sick of? Because me, I've ever encountered people who have come and asked for Septrin, but when it is a headache hurting them, but then when they have pain and then I tell you, give me Septrin. And when you ask them why they are buying Septrin, it tells you, I have a backache. Now, when you compare Septrin with a backache, there's no connection. Septrin is not a painkiller. And I've also encountered people who ask for painkillers, but when they have cough, someone have cough, but then they're asking for ibuprofen. And when you ask them, why are you taking ibuprofen? They're like, I have a cough. So, are you sure you have the right drug for that right disease? Secondly, the right route. Is that drug that you're taking, is it the right route? Are you using it rightly? With the right route, I mean, because we have different routes, we can give you a drug when it's supposed to be rectal, when it's supposed to be vaginal, when it's supposed to be injection, when it's supposed to be through the vein, it's intramuscular, it is underdermal. But then for you, because you never consulted, you can end up using a drug on the wrong route. And trust me, when you use a drug on the wrong route, most cases it might not work for you. Then also, is it the right disease? Yeah, because some of us tend to assume diseases, you know, because you're having difficulties in breathing, you're saying, I have asthma. Because you have chest pain, you're saying, I have, I have TB. You know, I always have this lady who comes around and asks you, Tao, I slept sweating at night. Does it mean I have TB? And some people have gone ahead and treated diseases they don't have. Because you have a fever in the evening, it could be you have a cold. Someone will come and is like, I have malaria. I've ever encountered people who come to me and they're like, I was hit by the rain and now I have malaria. Who told you rain causes malaria? Because when you read about the causes of malaria, it is a mosquito. But people have it in their head that when they're hit by rain, they have malaria and they come and buy cotton and they take. Are you sure you have malaria? Have you really tested and you have malaria? We have people who have allergies. But when someone comes, they're like, they have assumed, there are people who have allergies, but there are those who assume they have allergies. Someone is like, I'm itching myself so much these days, I think it is an allergy. Are you sure it is an allergy? Is it the right disease? Because we've made people who itch themselves when they need deworming. You could itch yourself just because there's an insect that bites you. You can even itch yourself because of the weather changes. Maybe you've gone through some chemical. It cannot necessarily mean everyone who itches their skin, they have an allergy. And it also doesn't mean everyone who is itching their skin, then they need deworming. So when you are taking this medication and buying them from those dispensaries, are you sure you're treating the right disease? Then also the right dosage. We have mothers who come and they're like, I need this, I need Pliton, I need Dexa, I need that. And sometimes they don't want to be guided on who is taking this medication and which dose they are supposed to take, because she comes and tells you, we got it, just pack for me and let me go. And then you reach there, you're giving a wrong dose to a child. Maybe even you. I also have people, even if you write for them the right dose, they will never take that right dose. They're like, me, I'm used to taking 4 tablets. You tell someone, no, take 1 capsule of Pyroxcam, and she's like, 1 capsule doesn't work for me, I have to take 4. Just know you're misusing those drugs in any way, that you're not doing the right dosage, you're not treating the right disease. Just to know you're misusing those drugs, and at the later time, they are going to cause an effect. Now, there's one thing that you don't know about drugs. Drugs are like poison if you use them wrongly. If you take a drug for a wrong disease, it is being misused, and it's going to bring a side effect that you're not supposed to suffer. Because drugs, like I told you, drugs is not like food, that it is something you're going to just eat anytime you want to eat. It's not like a sweetie that I can chew as many as I can. That's why we always put for you a right dose, depending on the age, and sometimes depending on the disease and the nature of the drug. Every drug has a dosage, and that is the right dose you are supposed to follow. For more information, you will follow us. Catch me next time. See you.